you.
For many of us, food makes the holiday. And if you are an older adult and you overdo it, you could really pay a high price, potentially with a health crisis that really could be avoided just by following a few simple guidelines. With us is Dr. Milagros Soto, a physician with Mercy Life, and the word life meaning living independently for elders. So Dr. Soto, let's talk about first diabetes and high blood pressure. Oftentimes in the course of a year, an older person is very well controlled. What do they do? What do they need to do, though, so they can continue to be well controlled through a holiday time when they really want to eat everything that they see?
It's understandable that during the holidays, people would like to eat their comfort food. And at Mercy Life, we work with our nutritionists to help them look for alternative foods or alternative ingredients when they make their holiday foods.
Let's talk about alcohol, because oftentimes that becomes part of the holiday celebration too. So how does an individual know that they're able to have a drink or maybe just a little taste of a drink for a toast?
Well, for older adults that are used to having their usual drink, it is okay to have some red wine in Christmas or their champagne toast during the New Year's. But they have to also contact their physician or discuss with their provider about alcohol drinking and the amount before indulging in alcohol.
Well, and oftentimes too, again, there is a routine that individuals are on, but those routines get interrupted. And then, oh my goodness, I didn't take my medicine. When do we know that that's a big problem? And what do you do if you missed your dose?
It's actually a good practice to either have a family member, set a reminder in their phone, or if they have a smart TV, set a reminder in the smart TV to actually not miss a dose. And if they have missed a dose, caregivers or the patient should speak to their care provider to see when they could replace that dose and not really double up before finding out a true direction from a provider.
So when do you know, and when should a loved one know that their older adult in their family really is ready for a program like Mercy Life?
So if you are an adult that you are a caregiver for an older adult and you have and you're working and you need a little bit of extra help, we can help providing different activities. We are able to take a person into trips, they go into trips, they do activities, they exercise. So this is a way to keep an older adult healthy, active, and communicating with other peers and also socializing.
Exactly. Dr. Soto, thank you. And I wish you a very wonderful holiday.
Thank you for having me.
So Mercy Life offers lots of programs at 4 locations to keep seniors independent and healthy. If you're interested in learning more, you can go to cbsphilly.com and click on to Talk Philly. We'll be back.